This is Marc Tobias with Dr. Bud Lateef. We're in Pittsburgh, Pennsylvania, and doctor, you're a pain management specialist.
Yes, I am.
And so you're deeply involved in drugs, narcotics for pain management.
Well, we treat pain using multiple treatment options.
Right.
Some of them are medications.
So you developed a series of products to protect and store drugs. And how did that come about?
Well, Mark, when I started practicing here in Pittsburgh after my training, getting out into practice and interacting with patients who are taking medications, I found that people were not storing their medications safely and safeguarding their medications. And I would have people come in with some of their pain medications into our clinic because we do something called pill counts. And so they would bring these medications in grocery bags. And these bags, some of these bottles would be falling on the floor. And basically I just started, counseling people that they need to safeguard their medications, and a lot of them were saying that they could not find any kind of products or place to put these medications. And so basically that's kind of how some of the incentive and the idea started, was basically just through interaction with these patients. And
how long ago was this?
Well, this was a long time ago. It was probably around 10 years ago. So I've been in practice for some time, and so this is probably at least 8 to 10 years ago when this actually started. I started kind of thinking about what I could do to actually help with this, and the problem was starting to become a big problem at that time too, and I started thinking about, as a person's practicing this specialty, what else could I do to really help my patients safeguard their medications. We know that there's a problem. Home environment can be a contributing factor to this problem, and what could I do to actually help my patients take steps to protect their medications.
Why were you concerned about protecting or safeguarding the meds?
Well, there are studies that have showed that 60 to 70% of sometimes medications that are diverted do come from the home. And so with those kind of statistics, those are kind of alarming. And if people are coming into my office carrying their medications in a grocery bag, to me that's not a safe place to put their medications.
Okay, but is the problem, I guess where I'm going with this, because I've done some reading, that the problem, there's a lot of abuse with kids, that they get into their parents' meds and they take a pill, they take 2 pills, especially with opioids now, that this can be deadly. Is that still a valid statement, or is that correct? Because just keeping your meds in a grocery bag, although it's not a great idea, if there's nobody that'll abuse those meds, it shouldn't matter.
Well, let's say if they don't have kids in the home, there's always people coming through the home.
Right.
Guests coming over, people to work on the house, cleaners. And so you have to be vigilant about pets can get into medications.
Right, that's true. Although pets can't open medicine bottles unless they chew them open.
Correct.
And if they can't open them, I'd like to see the pet. Because as in India, there's a problem with baboons opening door locks now. And so I don't know if they've graduated to pill bottles yet, or medication. A little scary.
Yeah.
So you came up with this product. Who designed it?
Well, I started looking at where I could get this product made and who could help, and I sought the services of Duquesne University's Small Business Development Program, and the person there that we reached out to was provide us with a lot of assistance. even till now, we're constantly in communication. So he basically assisted us in helping us source this overseas.
Yeah, I noticed your boxes are made in China like everybody else's, it looks like. What's the goal of the product with regard to security?
Well, these are basically just containers that can be locked to safeguard medications.
Okay, but when you say safeguard, what does that mean?
So this is something that you can put medication in to keep it, provide some level of security. Now, these are not safes.
Right, obviously.
Yeah, so they do provide some level of security within a small container, and that's really what our purpose is.
So, doctor, because there's no standards in the industry. I deal with standards for locks and safes.
Mm-hmm.
There aren't any standards for these containers. So I've asked everybody that I've interviewed, what's the criteria, or what are you guys aiming for as far as all security is about delay? Everything can be gotten into ultimately.
Mm-hmm.
So in your mind, what is your goal, or what would you represent in your product if you're selling this to parents to keep their kids out of getting into their meds or relatives, whatever? What's the criteria of delay? Is it 1 second? Is it a minute? Is it 2 minutes? And I'm not talking about forced entry either. Obviously, your plastic boxes, they can smash. I'm talking about covert entry where you can just, let's say a kid can get into it or whatever. What's the criteria?
Well,
because there has to be some.
Yeah, so, being a practicing physician, so on a practical standpoint, if you, as a parent or somebody at home, you really kind of have to look at your own security needs. Just like HIPAA has their own internal, you have to evaluate your own environment and take steps to mitigate these risks. Just as in the home, I believe every family should take a look at what are my risks. So do I have a person in the home who is dependent or drug seeking actively? And if I do, then where can I put medication? The answer is you should not have any medication in the home. In today's practice, we do screen for people in the home. Who else is in the home that has a drug problem? If they do, in a practical aspect, they should not be bringing in these opioids in the home.
But then how do you take them?
Well, they should not be. They really should not be on opioids. I mean, if they have pain issues, then pain can be addressed with non-opioid means. I mean, they get surgery. Now we can put in spinal cord stimulant implants. We can put in a pain pump in people. So in a practical matter, as a physician, I know that you have to look at your home environment. If you have an active drug-seeking person who is opioid seeking, then no container safe is going to keep that person from attempting to access those meds.
Okay, but you started a business to sell the safes. So
it's not a safe.
Okay, it's a box with a lock on it. You're correct. But again, so your customers buy your box. What's it supposed to accomplish?
So basically, we think it's a twofold method of deterrence. Essentially, it's a lockable container that you can store your medications, and B, it would be a sense of responsibility now that I have controlled substance in the house. And I think part of the problem that has led to this epidemic is this liberalness with medications, and people who are giving medication to family members or friends If you need a sleeping pill, here, take mine. If you have pain and your pain pill doesn't work, take mine.
Right.
We have a liberal culture, almost like a drug culture, that has allowed some of this problem to actually get worse.
Yeah, same
And
problem with
so-
antibiotics.
Yeah. So,
yeah, exactly.
So in a way, these medications are controlled for a reason, and so in a way, we're putting the responsibility back to the patient who is on medication. And every product that we have 5 ways to safeguard your medications. These are things that I've developed. Don't tell people about your medication types. Keep them private. Don't give access to a lot of people about your medications. People always saying, "Hey, go get my medication from the bathroom," and so you don't know what they're doing.
Right.
Know how much medication you have. We actually now provide a pill count sheet in every box,
Right.
or a patch sheet. And so that's where really the only way you'll know if you are having medication missing is you do regular counts. And so our products do come with a sheet that you can actually document that and keep tabs of inventory.
Okay, so here's the bottom line question. If any company and we ran into this in gun safes, in gun locks, a lot of different products. If one of these safes can be opened by a kid in 1 minute, is that a problem? Or 2 minutes, or 3 minutes? What's the criteria? Or 30 seconds?
Well, I think, we don't call these a safe, they're a container. And B, if your child is trying to get into these medications, you would want to do these pill counts that we recommend,
Right.
And document that. And B, if it is something that's happening, then you should definitely take steps to remove those medications from the home and get the child help.
Okay, but let me just relate to you. I go to Walgreens to fill a prescription years ago. And I'm asking them about prescription abuse because they have an app there, and I was wondering what happens if your kid registers your name in the app and starts refilling your prescriptions. The pharmacist says, not to worry. We sell this little drug safe for like $20.
Okay.
Little plastic with a combination lock on it. So I bought a few of them. About 5 seconds they're open. Is that security?
I mean, that's a really good point. I think, my view is that you need to know how much medicine you have in the product, and that's going to be the key. If they're getting into it, you should know. Nowadays, as a physician, people take multiple medications multiple times a day. So on your next dose, you should know, hey, I'm missing a tablet, and right then you should investigate that.
Okay, but if that was the case, you wouldn't need a box with a lock on it. You just need to do the counts. So the question is, let's say I have teenagers, and there is a drug abuse problem with teenagers with pills. And I buy your box, or I buy Voltz's box, or I buy any of these boxes that are out there, or pill bottles with locks on them. What's the minimum that they ought to protect against? I spent $40 on your box, whatever it costs. There's some expectation as a consumer that this box is going to do something. Otherwise, I can just put it in any box. So you have a combination lock on this box, which sends me a message that there's some security of the box. The public doesn't know anything about security. They have no idea how these boxes are designed. So the question is, again, is it 30 seconds? Is it a minute? Is it easy to get into? Is it difficult to get into? What do you think the public ought to expect? Because they're buying your products and everybody else's products. Everybody's on Amazon now.
Well, I think there's, we recommend that people should look in their home situation, and we actually have a rating on our products, like rating 1, 2, and 3. Some of them are very low security products,
Right.
and they're upfront. It's that every product has warnings on that. This is not a safe, and so these can be broken into. So these are, these are low level. This is not a safe. This is not. These are products that can be broken into. That is even the safe can be broken into. But our view is that you really have to kind of assess your situation. Really, if you feel like you need maximum security, then you have to wonder why you need that, and that's a bigger problem. And so, and these are products are just there to containers to safeguard medications with a lock.
So are there warnings? Oh, we haven't seen your containers yet. We're waiting to
We have
receive.
warnings,
Do you have
yeah.
warnings?
Yeah, we have warnings. We have warnings on the website. We have warnings on inserts right here. If you look right here, this product is not indestructible. It can be broken in.
Okay, but
It's on the carton.
Okay, and your Lockmed safes are made out of plastic, yes?
We have a couple different kinds. Some are aluminum based. Some are.
Okay. But they're all using a combination lock.
Well, we have lock bags too that
Right.
have a different
Like a
kind of
bank
lock.
bag.
Yeah, these are like steel.
Yeah,
alloy
okay,
type of
okay.
bag.
Those are probably more secure.
So yeah.
Except you can cut them, but then everybody knows it. So have you, when you said you work with Duquesne in product development, have you worked with any engineering groups to do any actual security testing on your products?
So so we basically have a kind of a 6-method process quality control through our association with the university. We found basically the best case manufacturer we could find.
Okay.
And these are manufacturers that are very well established, very high quality. They've supplied some of the largest multinationals.
Okay.
And so we start out with a good factory.
Right.
And then the most important part is the actual lock.
Yeah.
Okay.
That would be correct.
That's
The container. We've dealt a lot in China.
Yeah.
The container is okay, but it's the lock that's the critical
It's the lock,
issue.
and
Yeah.
so that is our biggest focus. And so for the lock, what we do for the lock is that we have hired a U.S. engineering company
Okay.
who is they focus on industrial locks and components. They're based here in the U.S. We don't deal with anybody here, so we basically use a U.S. company, hardware company,
Okay.
for their locks, and that's the locks that we put on our box.
But are these U.S. locks or these Chinese locks?
They have their own sourcing partners, but I mean, I'll share this with you. Actually.
Yeah, if you would.
Yeah. So this is. Yeah. So this is the Wind. Wind is ISO certified.
Wind hardware. Okay.
And so we use locks provided by Wind on our cases.
Okay. So have they done any testing?
So yeah, they have their own quality control testing. They have their own labs. They have engineers, and these are locks that are tested. So the second thing is what we do is we use locks that are provided by a ISO certified engineering company.
Okay.
And then we have quality control pre-shipment inspection that's done
Right.
prior to our products being released. The fourth thing is the factory does their own inspection on products
Right.
prior to releasing them, and then we do our own inspection, and then we do send them to an independent third lab here in the U.S. for testing too.
Have you done any focus group with kids to see if they can get into your containers?
With kids, I mean, we've done small groups. We're always trying to develop newer products.
Right.
And so, we're always doing small group testing with the public.
Have you tried to get into your container or containers?
Yeah.
Like how? If you were worried about, you have kids. If you were worried, if you had drugs in your house and you had kids, how would you be worried about these kids trying to get into containers? Because that's every parent, just like guns and gun safes, same problem. What would be your concerns?
Well, it would be,
Obviously, they smash the plastic box, but you're going to know that. The trick is to get into it without you knowing they got into it.
well, I mean, the combination locks that do provide some level of security. I mean, you have to really go through the combination. There's 1,000 combination
So
level.
it's 3 digits.
3 digits.
Right.
Plus the 0. So.
Well, it's 999.
Well, the triple 0 makes it extra.
Okay, so it's 10
And
times
then-
10 times 10.
And then the lock bags that we have, those are 4 digits.
Okay.
So you'd have to really go through a lot of combination types. So you know, unless you know how to pick it through other means or bust it open. So without destroying if you destroy it, obviously you would know.
Yeah, you'd know.
If you don't destroy it and you try to pick it, then that would be picked up on the med counts.
Okay, so is what you're telling me in summary, it's not really the security of the container. It's the responsibility to do med counts.
Yeah,
Which is-
it's exactly
After the meds are gone.
Well, these are things that, you know, it's a shared responsibility, and it's going to be, security is going to have to be at multiple different ways in the house. I mean, you can't just rely on bringing in a container and only a container
Right.
as hope that nothing's going to happen. So, you know, there's going to be some kind of responsibility on safeguarding these medications, counting the medications, making sure none are
Right.
missing, talking to your children about drug problems, educating the kids, making sure no one's in that area. So there's or a couple different layers of security into that premise of the house. Maybe put it inside of a closet that's also locked. So, you know, security is going to have to be, you know, in multiple layers.
If one of your competitors makes an equivalent box and a kid could demonstrate opening it in 15 seconds, 30 seconds, you think that's acceptable? Is that a problem?
Well, if there's a kid that's trying to get into your medication box, that's a problem.
Well, that's the first level problem. The second level problem is he does get into it. That's the big problem. And then whatever he does with the drugs, either takes them, gives them to his friends, whatever. But do you think, as a parent, no evidence of entry, let's say under 1 minute, no special tools, easy? Do you think that is a problem that shouldn't happen?
I mean, it's a problem that this kid is getting into the box. I mean, that's, for me, that would be a big concern. And so, yes, that's a problem.
Is there anything else that my readers should know about this issue or what they ought to do?
Well, I think it's, you know, this is definitely it's an important topic. You know, medications are brought to the home, and they can be used and abused and accessed by the wrong hands. And so, I think, you know, it's a bigger issue about home medications and being responsible with medication in the home.
And doctor, who's your biggest customers? Is it clinics? Is it just homes? Is it hospitals? Is it who, if you know, who's your biggest buyers? Is it just normal consumers?
I think we sell a little bit to all groups. I think we sell a little bit to everybody, and you know, we're still a small company, and so, and you know, we take care and pride in what we do, and you know, we want to do a good job, and you know, we want people to be aware of their situation in the home if they're bringing these medications in, and not just opioids, but it could be, you know, even blood pressure pills. I mean, any medication can be dangerous in the wrong hands.
Doctor, thank you very much. It's been a
You're
pleasure.
welcome.